Okay, so part 2 of the breastfeeding, we talked about engorgement, and I just finished talking about how you've got if you're a first-time mom, by day 3 is when your milk will increase. By day 5, it should be there, and if it's not, you would then want to talk to your doctor. But a mom who has a C-section, it can take almost 7 days for your milk to increase and to get full. So you want to make sure that you speak with a lactation consultant and kind of find out what's going on and make sure that you have your colostrum and the baby's getting enough. Don't overly worry about it, but just at that point, if you feel that your milk has not increased, then you could talk to a lactation consultant and get some help. And you're going to be in the hospital longer, so possibly by the time you leave the hospital, your milk will have increased, and the nurse and doctor can help you in that way. So for anybody who just picks up and starts watching this at part 2, we're talking about engorgement, and we're going to talk about vomiting and spit up, and is that normal? Those are 2 topics we're going to talk about today. So right now we're talking about engorgement, and this is when your breasts will feel very full. They will be swollen. They'll be painful. The skin is stretched. Usually it's shiny, it's red, it's warm. The only time you'd want to start to worry is if you find you have a fever or you feel like flu-like symptoms, where you're feeling really like your body aches and you have the fever or whatever. That could be a plugged duct, but it's common, but it's not like I had 4 and I never got mastitis. So you don't have to overly worry, but I did get engorged a lot. So with every pregnancy, I had the engorgement in the beginning. So don't overly worry that just because you're engorged does not mean you're going to have mastitis or plugged ducts. But the thing to look for mastitis is a fever and flu-like symptoms. And for a plugged duct, you'll notice redness and a hard feeling in one part of the breast, not the whole thing, but just one area is really tender. So that's a plugged duct, and then flu-like symptoms and a fever is mastitis, and you need to get to a doctor and take antibiotics for that. So engorgement is very normal. What can you do about it? So the best thing to do is increase your feedings. But at this time, a lot of times you find that the baby has trouble latching. So that can really, really be difficult. So if you could learn to hand express and look up a video, there are many teaching videos out there that can show you how to hand express. So you can hand express your milk. You can take a warm shower. Water tends to help, like warm water, and let the milk come out. Let the milk free up a little bit, come out of your breast. If you can grab your areola, the dark skin around your nipple, if you can pinch enough of that, then the baby can. But if you can't even pinch that area, then the baby's not going to be able to latch. So you got to soften just enough for the areola to be able to pinch that so that the baby can get it in their mouth and latch correctly. So if you have struggle with latching at that point, that's when you would want to try some of those methods. Now, what I did is I always would take warm showers, and I would just try to get the baby to latch as much as I could and to feed as much as I could, using any means you have. And might be TMI, but like sometimes I would use my husband to kind of empty that breast a little bit, because sometimes that is the only thing that could help. I didn't have a pump, and hand expression was difficult for me at that point. I did not know how to do it. Now I do, but I didn't then. So any means to get that milk out, get some of it out to give so that you can get the baby on there. What happens and why your breasts do that is because the breast doesn't know if you have 1 baby. It doesn't know if you have 2 or 3. It doesn't know how much milk you want. So what it does basically is it's sort of like what we do with our kids. You fill their plate, and whatever they eat, that they, next time you only put that amount. But sometimes it takes you a couple times before you realize, okay, they don't eat, this is how much they eat. So then now, as a seasoned mother, you know how much to put on their plate and how much they'll eat. That's how the breast works. It doesn't know at first, so it fills up with plenty of milk, and then by how much is left over in the breast, that's how much it knows not to make. So that's one of the reasons why it's so important for the baby to always empty the breast when they're feeding, because if there's any milk left in the breast will then make less because it thinks that it made too much. So when we're engorged, yes, we want that message to get across. This is too much milk. We don't need this much milk. But we also have to tell the body how much milk we do need. And the only way to tell the body that is to get the baby on there for every feed. We do not want to skip feedings. At this point, it's so crucial. Otherwise, your body will not know what to make. And if you continue to empty all that milk, it will keep making all that milk. So you have to be uncomfortable a little bit. But usually I want to say about 24 hours, 48 hours, it goes away. And then your breast will start to feel soft and you might think you have no milk left. When in reality, no, the body just knows when to make milk at that point and how much to make. And the only time you might feel that engorgement or that full again is if a baby misses the feeding. And then your milk starts to get full, or your breasts start to get full, sorry. So that is like the biggest thing about engorgement. It's normal. What to do about it: warm bath, shower, hand expression. You can pump. Sometimes though, with some women, the pumping can cause more swelling, so they don't always recommend it. But if you have a manual pump or whatever, you can try it to get some of that milk out, and there's nothing wrong with that either. I know a lot of mothers that's what they did, and that's fine too. You can use, anti-inflammatories like Motrin, ibuprofen, that kind of thing, if you're able to take it, because that will help a little bit with the discomfort. Now I'm going to show you a little bit. I'm going to show a picture. I'm going to try to take a picture and put it at the end of the video so that you can see these two. The first picture will be of the breasts and what they feel like and look like, or not really feel, you can't see what they feel, but what they look like in black and white, but the bigness of them. Sometimes your nipples can go completely flat when your breasts get engorged, and that's why it's so important to get some of that milk emptied, because once you can grab that skin around the nipple, the baby will be able to too. But if you can't, the baby can't. So test that. Always test that if you have problems with latching. Another thing that can make it difficult is pacifiers. So if the baby is sucking a pacifier and then you pull that pacifier out and you put them to the breast, that can cause some issues, because then they try to latch onto the breast the way they do a pacifier. Now, I'm not going to tell you not to use a pacifier. The recommendation is to wait 2 to 4 weeks before introducing a pacifier. I used them, but I did have difficulty. There were times that I would try to feed them right after and they would struggle, and we would have that first 10 minutes of crazy screaming and me crying and trying to get the baby to latch, and it took forever and so forth. But if you can do that. If you can wait the 2 to 4 weeks, that's great. If not, this would be my advice. Like, my suggestion is to give the baby the pacifier to calm them down, to quiet. Once they're asleep, take the pacifier out. Try to not feed them immediately after they've been sucking on a pacifier. So I think that would be what I would change if I were to have another baby. I started teaching breastfeeding after my daughter was 3. So at that point I wasn't breastfeeding anymore, and she was my last, number 4. So I did not breastfeed again, and I so wish I could have, because I learned so much about it after that I could have. I know there's a lot of things I could have changed and made better. And I did, like, for instance, I never pumped at work. I never knew, or even I just never thought about pumping at work and still feeding. It's almost like I didn't even think that it could happen. I don't know. It was just kind of weird. So now I would do things completely different. So that's engorgement. Now I'm going to spend the last few minutes, and the link between engorgement and what we're going to talk about next, which is spitting up or vomiting. And I'm using both because some mothers have a tough time telling the difference between spitting up and vomiting. And I would say the biggest thing that I would say are the differences is projectile. Vomiting is more projectile. It's more violent. So if it's a very violent type of spitting up in your mind, then yes, that would probably be vomiting. Spit up would just be, they sit up, you burp them, milk comes out. Sometimes they're just sitting there and milk comes out. So that's spitting up. Spitting up doesn't usually project. Now, that doesn't mean that it can't, depending on how the baby's positioned. If you go to pick the baby up and then the baby kind of spits up and it kind of goes down out the back side of you, that can be spit up. But vomiting, projectile vomiting, and they're doing that a lot, that is something that's not normal. I wouldn't be overly concerned about it where you start to panic. I wouldn't panic. But now you could say, okay, let me see what's going on and why they're doing this. And one of the biggest things that you can do to keep yourself from panicking is to check how much output they're giving. So how many diapers are they going through? If you're going through a lot of diapers and they're doing this projectile vomiting, you know that they're getting plenty of milk, but there's something that their body's reacting to, and it's why they might be vomiting after they eat. And you'll be able to know if they're actually getting enough, or they are just vomiting the whole thing, their whole meal. So that's kind of the best way to kind of gauge that, is looking at diapers. And a baby by day 5 should be going through 5 to 6 diapers a day from that day forward until, of course, they get a little bit older, things will start changing. But in those first few weeks, in those first few months, it's just 6 diapers a day in 24-hour period, and 2 or 3 of those can be stool. So you're looking for at least 6 diapers. So you could just pull it out at 7 o'clock at night. The next day at 7 o'clock at night, you'll see if you've gone through all the diapers. If you haven't, then you know that the vomiting is causing some problems. So then you would definitely want to talk to the doctor. It could just be something you're eating in your diet that the baby is allergic to or is not handling well. Not necessarily allergic, but just not handling well. So it might be dairy in your diet, because we tend to not give dairy. We don't give cow's milk to a newborn. And so that could be it too. It doesn't mean if it's not affecting the baby's output and growth and weight gain, then it's not something you have to change. If it doesn't seem to be making the baby uncomfortable, you don't have to change it. So it just kind of depends, getting help and asking for help, and definitely email me with questions if you would like help in that area, because I'll give you any kind of help I could possibly give. I'm a certified lactation counselor, so I can definitely help you if you have questions or concerns, and we can figure that out. So just spitting up is very normal. So if they're spitting up a lot, that's normal. Again, you can do the whole diaper checking to make sure that their output is good and that they are happy and fed well. So I would say that that's good. I am almost hitting 15 minutes, and this is these 2 topics maybe should have been on their own. So I might have to make a part 3 on this too. I guess I could do that. So spitting up and vomiting can be normal. They're not abnormal. In fact, they happen quite a lot. So we just have to figure out which one it is and if it's affecting their growth or their output. So that's something important to figure out. I'm going to end the video here and start part 3, where I'm going to talk a little more in depth about the allergies and something I missed on the engorgement. So I'm going to end the video here and start part 3 and go from there.